Okay, let me ask you something. Have you ever been told you have PCOS and then someone else casually says, "Oh no, it's PCOD," like it's the same thing? And you're just standing there like, "Wait, what?" Because that confusion, that's not on you. Most people never get a proper explanation. You're given a label, maybe a prescription, and that's it. No one really sits you down and explains what's actually happening inside your body. And that's scary, especially when it's your periods, your hormones, your weight, your skin, or your fertility involved. You start wondering if you're overreacting or if something deeper is going on. So in this video, I want to talk to you like a normal human being, not a textbook. We'll break down PCOS and PCOD in a way that actually makes sense. What's the real difference, why the symptoms feel so random, and what actually matters when it comes to managing it. By the end, I want you to feel like, okay, now I get it. Now I know what questions to ask. Now I know what I'm dealing with. Let's clear this up properly. Before we even talk about differences, symptoms, or treatment, let's pause for a second and talk about why this conversation actually matters. PCOS and PCOD aren't rare conditions. They're not 1 in a million problems. According to global health data, around 1 in 8 to 1 in 10 women of reproductive age are dealing with PCOS in some form, and PCOD even more common, especially in younger women. Which means chances are, if it's not you, it's your sister, your friend, your cousin, or someone sitting right next to you right now. The real problem isn't just having PCOS or PCOD. The problem is not understanding which one you have. Because when both terms are used interchangeably, people assume they're the same, and they're treated the same. And that's where things start going wrong. For example, someone with PCOD might be told they have a lifelong condition and panic unnecessarily. On the other hand, someone with PCOS might be told, "Just lose some weight, it'll go away." When in reality, PCOS is a systemic hormonal and metabolic condition that needs long-term management. This confusion doesn't just affect your periods, it affects how seriously you take your symptoms. It affects the kind of treatment you receive. It affects how early or how late things like insulin resistance, fertility issues, or hormonal imbalances are addressed. And here's something important that doesn't get talked about enough. PCOS isn't just a reproductive issue. It's strongly linked to insulin resistance, which increases the long-term risk of type 2 diabetes, heart disease, and other metabolic problems if it's not managed properly. That's why clarity matters. So this video isn't about labels. It's about understanding your body. It's about knowing whether you're dealing with something that's mostly lifestyle-driven and reversible, or something that needs consistent, long-term care. Because once you understand what you're dealing with, everything changes. You stop blindly following advice, you start asking better questions, and you make decisions that actually support your health instead of confusing it further. Now, let's talk about symptoms, because this is usually the part where most of the confusion comes from. If you've ever felt like your symptoms don't fit neatly into one box, you're not imagining it. PCOS and PCOD do overlap in some ways, but the intensity, consistency, and root cause behind those symptoms are very different. Let's start with PCOD. In PCOD, symptoms are usually milder and more irregular. The most common one is irregular periods. Maybe your cycle keeps changing, maybe you skip a month or two, or maybe your periods just don't feel predictable anymore. You might notice slight weight gain, especially around the lower abdomen, but it usually responds to lifestyle changes. A bit of acne might show up, maybe some hair fall, but nothing that feels extreme or suddenly out of control. That's because in PCOD, the hormonal imbalance is mostly limited to the ovaries. The rest of the body isn't constantly being pushed into a hormonal or metabolic struggle, so symptoms tend to come and go. And many women with PCOD don't even realize they have it until an ultrasound shows multiple follicles. Now, PCOS is a different story. PCOS symptoms are usually more persistent and more widespread because this condition doesn't just involve the ovaries, it involves your hormones, your metabolism, and even how your body responds to insulin. Periods in PCOS are often chronically irregular or completely absent for months. Acne isn't just an occasional breakout, it can be deep, hormonal, and stubborn. You might notice unwanted hair growth on the face, chest, or abdomen, while at the same time experiencing hair thinning or hair fall from the scalp. Weight gain in PCOS can feel especially frustrating because it often doesn't respond easily to normal diet or exercise. And that's not a lack of discipline, it's biology. Many people with PCOS have insulin resistance, which pushes the body to store fat more easily and makes weight loss harder. There can also be symptoms that don't get talked about enough, like fatigue, mood swings, anxiety, or brain fog. These aren't in your head, they're linked to hormonal imbalance and unstable blood sugar levels. Now here's where things get confusing, because some symptoms overlap. Both PCOD and PCOS can cause irregular periods. Both can show cysts or multiple follicles on ultrasound. Both can affect your skin and weight to some extent. But here's the key difference. In PCOD, symptoms usually feel situational and manageable. In PCOS, symptoms often feel systemic and stubborn, like your body is working against you no matter what you try. A simple way to think about it is this. If your symptoms mainly revolve around your cycle and improve with lifestyle, it's leaning more towards PCOD. If your symptoms affect multiple areas, periods, weight, skin, hair, energy, and mood, and keep coming back, that's when PCOS becomes more likely. And this is exactly why understanding symptoms properly matters, because it helps you move from confusion to clarity and from random fixes to the right kind of management. Now that we've talked about symptoms, the next obvious question is, why does this even happen? And this is where PCOD and PCOS really start to separate from each other, because while they may look similar on the surface, the reasons behind them are very different. Let's start with PCOD. PCOD is largely influenced by lifestyle and environmental factors. Things like chronic stress, irregular sleep, lack of physical activity, and diets high in refined carbs and sugars can disrupt how the ovaries function. When this happens, ovulation becomes inconsistent, and that's when multiple immature follicles start accumulating in the ovaries. The important thing to understand here is that in PCOD, the body's hormonal system isn't fundamentally broken, it's overloaded. The ovaries are reacting to external stressors. That's why PCOD is often seen in younger women and why it's usually reversible with consistent lifestyle changes. Now, PCOS is different, very different. PCOS has a strong genetic and metabolic foundation. If PCOS runs in your family, your risk automatically increases, but genetics alone isn't the full picture. One of the biggest drivers of PCOS is insulin resistance. When your body doesn't respond properly to insulin, it produces more of it to compensate. High insulin levels then stimulate the ovaries to produce more androgens or male hormones. These androgens interfere with ovulation, disrupt menstrual cycles, and cause symptoms like acne and unwanted hair growth. This creates a cycle. Insulin resistance increases androgens, and androgens worsen ovulatory dysfunction. Over time, this becomes a self-sustaining hormonal loop, which is why PCOS doesn't just go away on its own. Inflammation also plays a role in PCOS. Many studies show that women with PCOS have higher levels of low-grade chronic inflammation, which further worsens insulin resistance and hormonal imbalance. So PCOS isn't just about hormones, it's about how the entire metabolic system is functioning. There are also risk factors that can increase the likelihood or severity of both conditions. Weight gain can worsen symptoms, but it's important to say this clearly. Weight gain is often a result, not the original cause, especially in PCOS. Endocrine-disrupting chemicals, high stress levels, and poor sleep can also push symptoms in the wrong direction. So here's the simplest way to look at it. PCOD is often triggered by how you live, while PCOS is driven by how your body is wired, with lifestyle acting as an amplifier rather than the root cause. And understanding this matters because when you know the cause, you stop blaming yourself, you stop chasing random fixes, and you start managing your health in a way that actually works for your body. This is the part most people don't hear about early enough, and honestly, it's one of the most important reasons why understanding PCOS and PCOD properly really matters. Let's start by clearing up something important. PCOD, in most cases, does not carry major long-term health risks when it's managed early with lifestyle changes. Because it's largely functional and reversible, the body usually returns to balance once ovulation and hormones normalize.